Ladies and gentlemen, welcome to yet another episode of the Sunny Shah Show. Today, we have a very special guest with us, a veteran from the healthcare industry who spent almost 3 decades of his life serving India as a nation, transforming the healthcare within India, touching millions of rural lives. He has been pivotal and has pioneered in transforming the diagnostic divisions of healthcare. His experience surpasses our borders. He's also played significant roles in building and developing and scaling healthcare industry in our neighboring countries. A leader, a veteran who spent years working for large organizations like Quest, Metropolis, Novartis, Apollo, and now IVF. Ladies and gentlemen, please welcome Mr. Devendrasingh Rajput. Mr. Rajput, thank you so much for joining me on this show. Really an honor to have you here today.
It's always a pleasure to meet you and interact with you, Sunny.
Thank you so much. So I don't know where to start, but I think a natural question that comes to my mind as I think about a glorious 3 decades of your service to the healthcare industry. How does it feel? You would have joined this industry in your youth,
Yep.
serving this industry for over 3 decades. Can you tell me where it was and where it is now? Some examples that you want to share with our audience, and how does this feel after being in this industry for almost 30 years?
It's a wonderful journey, Sunny. I feel as if I started just yesterday. I still feel I'm just young into the system because you need that kind of enthusiasm and childlike innocence when you are approaching to the things. So if I see this journey of 27 years, I think how I have transformed and how the healthcare has transformed and also the ecosystem around us. We have seen a lot of transformations in technology as well as in the way we work. So it has been a marvelous journey. I would say we are the most fortunate generation that we have seen all the three transformations. Like we have seen the telegrams of the world, we have seen postcards, we have seen pagers, then we have seen mobile phones, and now we are seeing AI, right? So you can see the 4 or 5 transformations which our generation has seen. And in initial days, we used to work with telegrams and the normal postcard. So our managers used to send us a postcard that I am coming on so and so date, and please meet me at station. I will coming by and so express. So we'll go there and stand there at 11 a.m. That boss is coming. So we never know train is late or whether tour is cancelled, because that was the only way of communicating.
Interesting.
Or telephone used to be also a rare commodity those days. So we'll have a telephone in neighbor's house, or sometimes our distributors will call us that you have a message from your boss that his tour is cancelled. He is not coming. So it has been a wonderful journey, Sunny. And I feel I am fortunate that I have seen so many transformations and we have adopted those transformations so successfully.
And I think as an ambassador who's worked at the grassroots level in this industry,
Yep.
spending so many years, I think India is fortunate to have a leader like you in this space.
Yep.
And your contributions are highly regarded, so
Thank
to
you
speak.
so much.
And where the diagnostics industry stands today and the grassroots transformation that you've led has
Yep.
certainly helped the country immensely. With that being said, healthcare as an industry, where most industries evolve, we are usually looking at operational and technological changes or evolution. But with healthcare, it is technological, operation, and regulatory.
Yep.
With these three things combined, how do you think leaders in your space, with your own first-hand experience, of course, how do you think leaders in your space operate to keep up to these changes?
It's very important, Sunny, as you rightly said, transformation in these 3 sectors, like regulatory, less technology, as well as the experience. So all these 3 needs to be taken into your fold. So when you're approaching, means you cannot be resistant to the change.
Right.
So most importantly, you should be adaptive. So you should adapt to the changes, what is happening in the regulatory environment, or what are the customer expectations. That is most important thing. You should understand in today's generation what is the expectation. And you will see every 2 years there will be a trend shift, right, in the expectations of the healthcare delivery. And adoption of the technology from time to time is very important. You should be always ahead of the curve when new things are coming. Like in pandemic, we have seen,
Yes,
like the most of the healthcare innovations have happened
true.
during the pandemic. And the technology has helped us. And who would imagine that today your medicines will be delivered in 30 minutes?
True.
Or your home phlebotomy will be done within 45 minutes of ordering. So these kind of transformations have happened with the rigor of processes, systems, SOPs, and adoption of new innovative technologies, coupled with good training and empathy. So these are the few of the things I think we need to keep in mind.
Interesting.
Whenever I have seen, particularly in healthcare, like the healthcare delivery was never at doorstep in earlier times. So that has been the biggest change, that today we are giving healthcare delivery in the comfort of home. And people have been appreciating that. So today your quality of life has improved because you are getting most of the service at comfort of your home,
True.
click of a button. And definitely technology has played a role. Even our government or regulatory bodies have helped us to formulate this, adopt these technologies. So we should thank our leadership in the government also.
So you think the
for
political
helping us.
scenario in India
Yeah,
has actually catalyzed the transformation in a positive way?
absolutely.
That's nice.
We have seen that during COVID or during pandemic, that the government has been very supportive and the policymakers have been very empathetic towards the needs of the healthcare professionals. They were very supportive of us, particularly during vaccination or during testing of COVID. That is the kind of partnership, or you can say collaboration, is required.
It's very interesting. You briefly touched upon pandemic.
Yeah,
Was very unfortunate times for all of us. But one thing that stood out and that touched almost everybody that was affected directly or indirectly by
right.
the COVID-19 was the fact that our diagnostics industry, especially in India, stood tall. And almost overnight, we saw an evolution
Yeah.
in that space. Would you like to cite a few first-hand examples that you would have faced and intercepted during that time?
It was a lifetime experience for all of us. And the entire world was worried how the things will pan out.
True.
And we were not knowing this as a common man. He was not aware that whether I'm infected, or there were a lot of fear factors also there. A lot of misconceptions were there. So we had to work on both sides. One side, you need to work on the misconceptions, creating awareness. Second was delivering the service and rapidly ramping up your capabilities to address such a huge need. So I imagine, I can remember, there used to be a time when I used to have 40 or 50,000 inquiries a day for COVID collection, or 80 or 100,000 orders for medicine deliveries. So that kind of surge of volume was there.
And were you ready technologically to address that? Or you guys evolved over a period of
So
time?
that is the interesting part. That led us for innovation. We were not ready. Let me be honest. We were not ready for that. So we challenged ourselves and we came together as a group. Because here teamwork and collaboration is very important. Without collaboration, teamwork, you can't achieve such milestones. So we came together. We thought, how do we improve the customer experience? How do we reduce the servicing time? How do we reduce the turnaround time? Because earlier it used to take us almost 1 hour for planning and executing a route, right? Because it used to be all manual. We used to assign routes on telephone, right? But we worked on a dynamic roster, which was based on lat long. So here Google services, and we use the AI there. So we did a good transformation there, and we could reduce the collection time by almost 35 to 40 minutes. So we brought down the collection time to order by almost 25 minutes per slot. So that added me capacity of almost 35 to 40% in a day.
Interesting.
So in a day, I remember with 800 people, we collected 24,000 samples.
Interesting.
So that kind of surge of volumes we have seen. And this is all possible with collaboration, teamwork, and innovation. Without a good innovation or without a dedicated team, you can't do that. So nobody is perfect. We need to all come together and we need to work on the ideas. We need to work on the implementation part, and you need to continuously evolve and take feedback from the ground, because there even a small user on the ground is very important, because the aspect what he will give, nobody can tell you. So that has really made the challenging phase very easy for us. And I think we did it very well.
I think we all coined this term called COVID warriors.
Yeah.
But I think it is important to recognize silent leadership, people like you during those times that quietly performed and executed what was asked to transform an industry overnight to support the sheer population of our country. So I think your contribution to your industry during that crisis situation deserves a lot of applause. Thank you so
Thank you
much
so
for
much.
what you did in your space during that time. I think in a way, you were a savior to a lot of Indians, and we can only be thankful for that.
Yeah. We think it was an opportunity given by God to us to serve the people and save so many lives. It was a noble cause.
Very interesting. So with this disruption, we are in an age of disruption where technology is almost landsliding everything that we've done and moving ahead and helping us evolve in each of this industry. Diagnostics, patient care, and operational efficiency. Where do you see the long-term impact of this disruption in these areas?
As you said, Sunny, this is going to stay. Like the customer experience has really changed. The expectations as customer, the bar has been raised. So we are able to sustain on that, right? Because now today you are almost 35 to 40% of the delivery of service is happening from comfort of home. So this is going to stay. The medicine delivery is going to stay. Your online consults has gone up, right? So almost 20% of your consults happen online now. Almost 20-25% of the home collections or the medicine delivery is happening through digital channel.
Do you think this is happening only in the metros, or are tier 2, tier 3 cities also blessed with this kind of transformation?
So metros have adopted this change very early, and even we are seeing a good adoption in tier 1 cities now. I think tier 2 or tier 3 might take a little bit of time.
And do you think this is an opportunity of growth?
Definitely. Tier 2, 3 is the real area of growth, because we need to have good logistics and good warehousing solutions, which will help us. Currently, I think those areas where little bit of work has to be done, because you will need a good supply chain and good logistic network to support tier 2 and 3.
Very interesting. Do you think a lot of initiatives are happening through government-private partnership here, or is it more like private players leading the change to bring in the kind of infrastructure that is required to lead this change?
I think it is mostly driven by private players. But certain areas, I think even government is playing a key role for healthcare delivery. So there are certain models where I think the healthcare delivery is happening with the help of public sector also.
Given your 3 decades of experience as a leader in healthcare space, what challenges do you think the current executives in your industry are facing?
So currently, I think the challenges are quite high, if I say honestly to you. So the major challenge is today to retain the talent, because India is growing, right? Healthcare sector, most of the sectors, if you see the CAGRs in diagnostic is almost 12%, or even single specialties like women and child care, the CAGR is almost 15%. So you can imagine the kind of job opportunities that is opening up.
Right.
Particularly in the mid segment of the careers, like technologists or people who take care of their patients, caregivers, or even the people who are managing these services, right, backend. So a lot of career opportunities are there. But having said this, people are also have become very aspirational, right? So people want to shift very fast. They want quicker promotions. They want higher pay packages sooner. Right? So I think these are the main challenges. Secondly, adoption of technology and having availability of enough manpower who has those skill sets. Because most of the graduates, we don't get that desired skill set. Yeah, but they are aspirational. So we need to work with them to develop their skills, give them a training. So getting a qualified and skilled manpower is a bit of challenge.
Anything other than manpower challenge?
Adoption of technology, I think, is one which is definitely people need to work on.
But that's true across all industries.
Yeah.
Not just limited to
Yeah.
health. Makes sense. Makes sense. We talk about the business of healthcare, but you are in a business where you also have patient centricity.
Right.
Obviously, everything that you do still evolves around maintaining a strong patient first approach. So, what strategies have you seen in these large brands that you worked for throughout your career that are helping keeping this balance in place?
The most important thing is your relationship with the customer. So empathy is very important. How your staff is trained, how they communicate with the patients, because they are already in pain, they are suffering, they are anxious most of the time. So they need somebody who can listen to them. So that itself will take care of half of his anxiety. So training is very important. Then how you engage with them, how you give them information. So there the role of your frontline staff is very important, because your phlebotomist or nurse or your frontline reception, they are like a brand ambassadors for you. Then comes your technological or your medical care. So there, of course, doctors are experts in that. So how you navigate that process, that is very important. And how you build that bond, that is a process. So it has to be a process driven. Means you need to train your people how to communicate, how to be empathetic, how to make them comfortable. That is very important.
I have a follow on question on that, right? I feel that the healthcare industry in India is on the cusp of large scale disruption. So, if you were to look at the insurance industry in India, well, I remember almost a decade ago, people were not that cognizant about the fact of how important insurances are, let alone your term insurance or health insurance. But now that you see that cognizance and you see that sense of responsibility emerging, and that
Right.
has led to a transformation and disruption in the insurance industry.
Absolutely.
I feel we are at a cusp of, obviously pandemic triggered it,
Yep.
and the aftermath of pandemic still persists, where a common man is more health conscious and
Right.
is becoming more self-aware and is setting the right priorities for his or her health well-being.
Absolutely.
With that being said, it's fair to assume that the healthcare industry as a whole, not just the diagnostic part of it or patient care part of it, but overall, the health industry in India is on a verge of a massive disruption. How do we ensure that the cost of healthcare or the privatization that's leading this change or the business centricity of our healthcare industry is still balanced in a way where, while it's commoditized, while it's a business,
Yep.
it still has, because it's an empathetic business
Absolutely.
and it has to be led by a right balance and checks and measures. Do you think that's happening, or is India going in the same track for a lot of first world countries where access to healthcare is a privilege and not a right? Where do you think we are?
I think our bed to number of patients as well as number of doctors ratio is still, there is a lot of catching has to be done, particularly in tier 2 or tier 3 and tier 4 locations. But the healthcare is shaping up well in tier 1 and metros, right? You'll see a lot of single specialty or the mid-size hospitals are coming up and they are doing well, right? And I think this trend will continue for another 8 to 10 years, where a lot of bed capacities will be added in tier 1, 2, and 3 even. So you'll see a lot of capacity addition in this sector. Second is insurance is definitely helping. The adoption rates have gone up. And also the government schemes are also helping here. So Aishman Bharat, and they have really improved the healthcare delivery, right? Even if you go to district places now, so a lot of people are taking benefits of that. Even bypass and that kind of surgeries or cancer care, I think is being highly subsidized by many of the state governments and also by central government. So that is a really good trend what I am observing. And I think India is still, I think you will say we are getting good service at a reasonable price.
So you think the
Balance is absolutely there.
and for a foreseeable future, healthcare continues to be easily accessible versus a privilege.
Yeah,
for
it
an
will
average
be,
Indian,
I
right?
think accessibility is growing.
Is
And
good.
it will only improve from here.
But that's
So
very
I'm seeing a very bright future for the mid-segment hospitals, primary care, because our demographics is changing,
right.
Sunny, today. Number of diabetics, cardiac and cancer, the numbers are exploding. Right? So there is huge pull which will come in next decade's time.
Interesting.
And also population is aging slowly. So these lifestyle disorders, NCDs will grow now, non-communicable diseases, which includes diabetes, heart and cancer. So today we are having more than 1.5 millions of documented cancer patients. So that is a huge number. And diabetics, we don't know how many are still undetected. So that is the kind of opportunities, and healthcare needs are only going to go up.
We are an age where in 10 years from now,
Yep.
India will have the largest population coined as senior citizens that we've ever
Absolutely.
had in our history.
Absolutely.
Do you think our industry, especially healthcare, is geared up to cater to that kind of volumes?
I think that is where a lot of hospital chains are adding capacity.
Okay.
You will see every city, I think there will be few hospitals which are under construction. So I think capacity addition is happening. And also they are going deeper into these. So hub and spoke models are being now put into place even in hospital industry now. So that care as well as the delivery patterns, I think, are getting quite SOP driven. So hub and spoke is getting created, primary care, then secondary care and tertiary. So those models I'm seeing evolving across India.
Talking about diagnostics, where we are now adopting to a lot of next gen technologies, AI, for example,
Yep.
to diagnose and hopefully cure
Yep.
or treat somebody in future. How do these large brands cater to patient trust when something that is technological and with a minimal human intervention is at the forefront of diagnosing an illness? Where do you think we stand? What are these large brands doing to gain and sustain patient trust?
So here, after pandemic, I will again go back to pandemic area. After that, awareness has gone up. So everybody wants to know in advance that what is my health looks like. So a lot of predictive as well as preventive diagnostics is happening. So a lot of youngsters as well as the 30 plus people they have adopted for wellness as well as health checkups. So that is one area which is growing very fast, wellness as well as preventive health checks. And their role of AI is coming very fast, right? So there you are able to predict how soon you are going to get a diabetes or how prone you are for cardiac disorders. Or maybe there are algorithms which will say what is your cancer probabilities. So there are AI tools which are available. But it has to be backed by a very good counseling.
Right.
Without counseling, these tools will fail. Right. So it has to be a very good collaboration and teamwork between AI and a human intelligence. Because it cannot be substituted.
Interesting.
Counseling is very important. So what do you do after you get a report, right? So somebody needs to collaborate, engage with them, counsel them. What are the outcomes of this? What is the lifestyle modification you need to do? What are the preventive steps it has to be taken?
And you think with technologies like AI getting in play down the line with better healthcare and curative practices, the human life expectancy in a country like India will eventually enhance?
Definitely. I think the life expectancy is going up. At the same time, your complexities are also growing, right? So you need better tools, better systems to manage because comorbidities are very huge today.
Right.
With your diabetes, you'll get other comorbidities. So you need to manage that whole piece. So the wellness piece is coming very fast, or your lifestyle or the diet pattern. So it is a whole ecosystem which is getting developed, Sunny, I think, with the change of lifestyle, change of demographics. So a lot of good industries are evolving wellness or nutrition. A lot of people are moving towards millets. So you must have seen a lot of trends evolving. I think this is ongoing process, and this will help everyone to have a better life.
That's very interesting. With the use of technologies like robotics, AI, precision medicine, etc., etc., how do you see these technologies in your industry influencing leadership decision making in the coming times?
Yeah, see, AI is going to help us, right? So AI is our friend or buddy, I would say.
Right.
So they will help us to make better decisions. AI is going to help us because today we are driving certain algorithms which are going to help us to diagnose or have a summary very quickly so that we can make a informed decision driven on the data. So today, if I input all the reports, the diagnostic reports, and the key in all the patient history, so you'll get a algorithm of chances of success or what treatments has to be done. So it will make the job of the physician very easy. So what medicines I should give, what is the lifestyle I should ask for the patient.
So, do you think this data driven decision making practices are going to replace the traditional way of clinical expertise, or are they here to complement each other?
They will definitely complement each other.
Right.
Because you cannot substitute the expertise, right? Because that is the human intelligence. It is based on the years of experience.
True.
You cannot substitute that because there will be certain intricacies which AI won't be able to solve. So that will be, data will give you a 1 point, but at sometimes you'll have to take judgment. And that is where role of physician or caregiver or healthcare professional will come.
We are in this age of digital gratification. Everything is at a click of a button.
Instant.
Everything is instant, right? Or near instant.
Yeah.
In this age, what role do you see digital healthcare platforms perform?
So digital healthcare is helping patients for awareness. It is a very good tool for engagement, right? And it has also transformed the experience, right? So it has integrated to certain extent. You must have seen there are certain very good platforms. So I was fortunate to be a part of one of the launch of platform, healthcare integrated platform. So there we have seen a very good adoption of health tech as well as consultation as coupled with the diagnostics and pharmacy. So I think these are the things which are going to help us. And it has changed the patient engagement as well as their expectation. And it has definitely improved the quality of life or the ease of diagnosis or the runway for diagnosis as well as for treatment has shortened, I will say. So these platforms are helping you to, I think, shorten the diagnosis to treatment time.
That's very interesting. I'm pivoting from this topic for a minute because I need to ask you on this aspect. We've been observing your work and we've been observing you on social media platforms, being the thought leader in your industry. The kind of reach and the kind of accolades you possess as a leader is something that can be earned, and it's not something that can be compelled upon. A simple example, like whenever you post something or whenever somebody posts something about you, in a span of a few minutes, hundreds of people posting and liking it. I want to know what led to this iconic leader in healthcare space that we know as Devendrasingh Rajput today. And how does this feel being a popular face in the industry?
So Sunny, as you said, the leadership is engagement, right? So I firmly believe in the acronyms of leadership. So there are 6 alphabets. L is listening. E is empathy, right? A is appreciate. D is develop, right? So you should always help your team to develop. E is again empower, very powerful tool. And R is respect. Because without mutual respect, you won't be able to move forward, right? So listening is very important. If you don't listen, you will not get $1 million ideas. I'm telling you. It will always come from the ground.
Right.
You should interact with the ground level people. So the best ideas I have always got from the ground level or from the
by listening
field.
to them.
By listening to them. They will give you very powerful ideas. Then when you give them enough of attention or you give them advice, I think they will always listen to you. So you should always give them chance to develop.
Right.
You can always give them a constructive feedback, because feedback is very, very important. And based on that, you can give them smaller assignments
Right.
to develop their potential. You will see a lot of transformation, which I have seen in my team, by giving smaller projects or projects he thought he will not be able to do, but they are done wonderfully well. There are many examples like that. Then empathy is very important, because without understanding the perspective of the person or the team member, you will not be able to see the other side of the story. And you might sometimes, I have changed decisions also after listening empathetically. And respect cannot be replaced, right? You should respect him as a human. You should respect him as an individual, as a professional. So that will cumulatively, I think, they will give you a very good output, which will mutual respect. Then that comes out naturally. People will, so we'll say people follow you, but I don't think they follow you. They are just affectionate with you, or they want to appreciate. So it is not followership, I would say. It is collaboration, or it is mutual respect.
I know it's difficult to quantify, but for the interest of our audience, would you be able to kindly tell us how many people have you touched upon in your life as a leader? Can be a guesstimate.
So I must have hired more than 10,000 people.
10,000 people in
Yeah.
India.
So created a lot of job opportunities, particularly in newer geographies with innovative business models. Because we have created outreach in healthcare. We have gone to tier 2 or tier 3 markets by and large. And it has been a business transformation in unorganized sector. Unorganized to organize is a bigger journey, I think, which will continue to happen in India. If you see the healthcare landscape, so a lot of transformation is happening and it is in progress. Touching the lives through innovative business model is very important. How you collaborate, how you find ways to reach out to the end users is very important.
Very interesting.
Yeah.
You are at that juncture of your career in the healthcare
Yeah.
space where I'm sure you are investing a lot of time in building the leadership of the future
Right.
that will continue to transform and hopefully surpass your contribution in the future for
Yep.
the betterment of everyone. What is that important leadership trait do you think one must possess to be a successful future leader in the healthcare space?
So most important aspect will be empathy.
Empathy.
I always tell my team members or my juniors that you should be empathetic. Right? Without empathy, I think the most of the things will follow. If you listen empathetically, or if you see the perspective, or if you engage, then the entire conversation will change. And that will help you to engage better with the team, right? It will help you to have good bonding, because trust is something which is very important. So empathy will lead to so many changes.
Right.
So it will ultimately lead to the building of trust. So most important is trust and empathy. And second is how you adapt to the changes. So these are the two most important things. Rest, everything will fall in place. If you are adaptive, if you are innovative, if you want to adopt the change, or if you are a change leader, I think things will be in place. Your skills, other things can be developed. But these are the two very important things, empathy and your adaptability.
I have a follow-on question on that as well.
Yeah.
How do you think leaders in your space, what do you think they can do to ensure a sustainable and extremely motivating work environment for healthcare professionals?
I think we should institutionalize a good model where we developed a emotional quotient within the team, right? Because that is very important. Empathy comes with a lot of responsibility. So how do you take it towards your team as well as towards the patient care? That is important. So we should institutionalize this, at least wherever I am working in my role. So I make sure that there is enough of interaction with the teams. Then you also help them to develop their career aspirations. So a structured program on leadership development, skill development, and also their knowledge on the science is also important. These are the 2-3 aspects I think as a industry or as a leader. If you adopt, I think things are changing very fast, and it helps you to better engage with the team. It also helps you in retaining people. And of course, the productivity goes up without saying. That is byproduct. If people are motivated and they're engaged, productivity naturally will be better.
My concluding question for this podcast is, you had a quite interesting career
Yeah.
in your space, and I'm sure a lot of gratitude follows with
Yeah.
what you accomplished so far. In this time of 2025, where do you see yourself? What are the next big things that you plan to do in this space?
So Sunny, life has been very happy for me, and I'm grateful to God that He has given me opportunity to serve so many people and do a different roles in my career. So I'd like to give back to the society. So I'd like to develop a lot of leaders. I would like to coach or mentor people so that they can benefit from the experience or what ideas I have. Then as a leader in this industry, healthcare, so there are a lot of challenges in our society, non-communicable diseases. So I'd like to definitely create such a system where people get easy access to the information
Right.
on their lifestyle, on the preventive things. So I would like to contribute on that so that the quality of life improves. The outcomes on non-communicable diseases is better because non-communicable diseases are silent killers. So I want to create awareness as well as create a platform where people are able to access to the information and take positive interventions into their lives, which will make human lives better and we all can live healthy and happy life.
Very interesting. Devendrasingh Rajput, thank you so much, sir, for joining us on this podcast. It's a privilege having you here today, and quite impressed by the changes you are leading in your space, and by knowing the fact that the Indian healthcare industry is shaping towards the betterment of everybody across us. So thank you so much. It's a pleasure having you on the show today.
Thank you so much, Sunny. It was pleasure talking to you, and it is always pleasure to be working with leaders like you. Thank you so much.
So, ladies and gentlemen, don't go by the modesty of this man. He has played a pivotal role in the formative stage of the Indian healthcare industry, from the time it was unorganized to making it organized, from the time it was unstructured to making it structured, and now leading the change for the digital disruption in this space. That's Mr. Rajput for us. Please follow him on LinkedIn and other mediums. You can find his details in the description below. Please do not forget to subscribe to our channel if you haven't done so that we are able to bring you more such insightful discussions. Until next time, this is me signing off. Thank you so much.